Good morning, good afternoon, and good evening, depending on where you are. My name's Dr Anushka Patchava, and I'm here to talk to you about the future of health insurance now. Today's agenda covers key trends within the health insurance industry, particularly in light of COVID-19, where the macro environment has shifted, and we know that the healthcare landscape has shifted alongside that. We'll also be talking about how Vitality has responded to the pandemic, and then look further into the future for opportunities within digital healthcare and beyond. Let's think about the pandemic. 2019, 2020, and 2021 have been years the global environment has never faced before. The pandemic has become rife, and across the globe, we've seen several shifts in terms of how we do business, healthcare provision, and social economic developments. The first trend we've seen and noticed is that the fact that resilience, wellness, and healthcare has become so much more critical than ever before. The general population's awareness of health and health conditions is ever rising. In addition, businesses have echoed this sentiment with a renewed focus on protection, and several employers prioritizing wellness and insurance initiatives for their employees, knowing that this is what attracts and retains high quality talent. And then let's think about the acceleration towards a digital world. Several sectors prior to the pandemic, for example, retail and banking, had already evolved into that digital space. What's different though is healthcare was always a lagger, behind the curve, not really interested, dibbling and dabbling. The pandemic has catalyzed that and changed it for the better and for the good. Now, more than ever, we see clinicians and patients, as well as providers and payers, very much engaged with digital healthcare and blended care delivery models. So that acceleration to the digital world has been realized as a result of the pandemic and has really had an impact in particular on healthcare and the health insurance sector. And then finally, across the globe, we've seen a shift from I to we in businesses. We've seen collaboration across governments, particularly in development with the vaccine and the rollout. And we've seen a real renewed focus on population health and what's best for population behaviours in order to achieve health outcomes. Health and well-being has never been more important. We know lockdown and remote working has had a significant impact and a detrimental impact on our health. Let's take a look at a few statistics. So the relative risk of COVID hospitalization actually was shown to decrease depending on the physical activity you engaged with. One of our studies demonstrated that high physical activity, so those that engaged with over 30 minutes of exercise a day, realized a 27% reduction in COVID hospitalizations. And this survey was in a group of males aged 40 to 49. We also know from the pandemic that activity events in our membership decreased. Of course, as a result of lockdown, gyms closing, social distancing, and other governmental public health measures, this was not unexpected. The average activity levels have dropped compared to pre-COVID levels, approximately 23%. However, a positive side of that is we quickly at Vitality pivoted towards a Vitality at Home solution, offering wards and partner benefits and lifestyle engagement applications to enable our members to stay active healthier. Finally, we know mental health has been ever increasing. It's been a silent burden for a very long time, almost an untalked about space. Attention has been given to waiting lists in cancer, for example, rather than mental health. But the COVID pandemic has shifted that. We know that the percentage of adults with symptoms and depression has gone up significantly and almost doubled in the UK health ecosystem. The pandemic has taken a toll on people's mental health, with depression, anxiety, and general well-being all deteriorating. And this is something the healthcare system of the future, be it healthcare insurers or healthcare providers, will really need to consider deeply when they look to strategize into what delivery models and what services to offer. The impact on the pandemic on the health sector has been widely publicised. We've seen the disruption to healthcare delivery. We've seen the year-long waiting times increase for surgery, and this being publicised across media broadly. We've also seen the positive. For the first time ever in the UK, we've seen really strong collaborative relationships between private and public systems. We've seen private hospitals being brought in to manage the NHS case burden and relieve some of the significant pressure we know the NHS is under. In addition, another fantastic positive is that accelerated adoption of digital healthcare. NHS GP appointments swiftly moved to digital, and we can see that the activity being conducted remotely is way above 50%, and we expect quite a large proportion of that to stay around in years to come. Of course, once you've realised the accessibility and the convenience of a digital healthcare solution, being able to see your doctor at home, at your desk, while you're walking, wherever, it's very hard to go back and put yourself in a physical environment. We also know that the psychological state of humans within the population, having experienced and gone through the pandemic, has made it incredibly difficult for them to re-engage with physical healthcare services, particularly because the risk of catching COVID in those environments is relatively high as well. So let's think about how Vitality has responded to the pandemic. Vitality as a business has always been about supporting our members. We strongly believe in a shared value model. What does that mean? Shared value is about delivering the right services, not only for ourselves and our members, but for society as a whole. What can we bring that can be positively contributory? And we've been looking after our members before, during, and we continue to do so as we come out of this pandemic. The interventions we've demonstrated, either through health and wellness, prevention, lifestyle measures, or incentivization towards health rewards, has really shifted healthcare outcomes. We note better health, 1.5 years of additional life expectancy in that population that are engaged. We see it enhanced productivity, so 50% higher productivity for those that are engaged. And we've also noticed that with Vitality at Home, the initiative we launched during the pandemic, we've managed to deliver approximately £20 million of savings back to our members and society. And what do I mean when I say engaged? An engaged member to us is one that is aware of their health, is aware of their health behaviours, and is looking to action and do something to move that towards a better state. Be that with lifestyle measures such as exercise, diet and nutrition, or, as we've noted during the pandemic, the importance of mental health, engaging with meditation, yoga, and techniques such as that to prolong and potentiate positive mental well-being. Let's talk about that shared value model. Our shared value model is a demonstrable force for good. Why is that? Through engaging our members, we can give back less absenteeism and higher productivity, as we've seen previously. Through engaging our members, we also ensure that they have an increased life expectancy. And finally, for us as an insurer, highly engaged members drive improved retention and lower claims. We've talked a little bit about digital health and how the evolution of digital transformation was catalysed by COVID. At Vitality, we have focused on remote and digital healthcare solutions during the pandemic. Our 2020 numbers give you an indication of the engagement and utilisation we've seen in these services. For example, we've noted a 13,000 consultation increase in those seeking and engaging with remote specialist consultations. We've also seen, using our digital partners like Ascenti and My Online Therapy to deliver physiotherapy and mental health solutions, respectively, over 10,000 consultations being delivered to our member. We've noted there's a 44% increase in the use of cancer treatment at home. What do I mean by that? Well, previously, our members used to travel to a healthcare provider, either in a location near their home or sometimes further afield, in order to receive their chemotherapy treatments. Now, as a result of the COVID-19 pandemic, we have catalyzed the delivery of chemotherapy at home, safely, effectively, and ensuring the member is able to benefit from the comforts of their own environment whilst receiving quite debilitating treatment such as chemotherapy. Furthermore, we know primary care has suffered as a result of the COVID-19 pandemic. We've seen GP waiting lists in the NHS ever increasing. Our VGP service, powered by Livy, has seen 25% increase in digital healthcare consultations, and alongside that, we introduced a 24/7 GP advice line, which was equally well utilised. And care isn't just about member care. It's not just about healthcare. For us at Vitality, creating the right healthcare and health insurance experience is key and critical. Instant digital authorization for new claims is something we are incredibly proud of, having achieved this during the pandemic. This service, soon to launch, allows our members to access their documents, their claim records through the Vitality Care Hub, and not only access it, but they can initiate claims online and get instant authorization. We've also introduced a consultant finder, making care more accessible and bringing care to members in the palm of their hands. Our consultant finder allows members to find, compare, and book specialty consultants so they can get the right consultant at the right place at the right time when dealing with referrals and onward care. The consultant finder is a tool that empowers members towards owning their care, seamlessly being able to research and book consultants along the digital claims journey. There's 3 easy ways the member can access and use our consultant finder. They can search for a consultant displayed in the order of best match based on their location, their needs, and their required hospital and specialty. Then they can choose the right consultant. We have a group of consultants called Premier Consultants, which I'll tell you a little bit more about in a second. But our Premier Consultants are clearly identified with detailed profiles on the consultant finder, so our members can make informed healthcare decisions when they need it. And then we wanted to make booking and scheduling easy and accessible to all. So the ability to book online and access consultations has really shifted the way we deliver healthcare to our members, and improved access, which we think in turn will improve outcomes. Let's take a look at our consultant panel outcomes. The Premier Consultant Panel is what we use to define our consultants who we profile based on outcomes, based on the number of operations or procedures they do, and based on user feedback. Now, more than ever, these metrics are critical in defining the future of healthcare and the future of health insurance. The Premier Consultant Panel demonstrates superior performance. We've noticed with our Premier Consultants, length of stay has decreased significantly, over 20%. And who doesn't want less days in hospital when they're unwell? We've also noticed our Premier Consultant Panel has achieved over 35% decrease in the length of stay and readmissions. So readmissions is a key. When you're unwell, you want to be able to access healthcare, to be treated effectively, and to move on from that seamlessly without having to go back and forth, yo-yoing between hospital and home. Reducing that readmission rate by 35% demonstrates the true quality of our Premier Consultant Panel. Finally, let's talk a little bit about the future of healthcare, and in particular of health insurance. What is the future of health insurance? I can tell you it is now. What we do isn't changing. Healthcare is built with robust guidelines. NICE, NHS Digital, whichever organisation it may be, is really driving healthcare forward. There's a wealth of clinical evidence, there's a wealth of policies, and there's a wealth of best practice already within the UK ecosystem. However, how healthcare is provided must change. The importance of blended delivery models has become ever more apparent as a result of the pandemic. And I want to explore that a little bit more. From paper to digital, from hospital to home, driven by data and new technologies, be it AI, artificial intelligence, AI 2, augmented intelligence, virtual reality, augmented reality, or something else. What is the future of health insurance now? I'll share with you my 5 thoughts. 1. Omnichannel. From acquisition to servicing, with inclusivity at its core, is critical. Accessing and being able to interact with members beyond just the face-to-face interactions, which were banned in the pandemic, to more broader interactions, be that through content on social media, advertising on televisions, and or webinars and forums, quite like this one, delivered digitally. The second element is personalisation. Members, patients, consumers are all itching to be noticed. Personalisation aligned to member risk as well as need is so critical for twofold. 1, to develop brand advocacy and member relationship, but 2, to help the overburdening of healthcare systems. Number 3 is connectivity. Across all services, no one wants fragmented journeys. No one wants difficult 10-click journeys, online or in person. And no one wants to have disparate data sources. What's really important is connecting all of those things across all services, bringing integrated care, consultations, referrals, tests, investigations within the healthcare ecosystem. And then having data fluidity flowing through from payer to provider, from primary to secondary and tertiary care, and in the palm of the member's hands, enabling control and that connectivity. The 4th point is around wellness. We know prevention and wellness is ever more important. We know that members wanted to engage with health and lifestyle behaviours to prevent acute admissions and contracting COVID-19. And we know that trend will continue. Being wellness and prevention focused is not just about treatment. It's about looking at a member holistically, and the importance of health insurance in the future is taking this forwards into how they deliver either care and or communications. And finally, what is health insurance of the future? It is about right care, blended care delivery models, care the way the member seeks it. Right time, convenience and access is key. Right place, we talked about physical and digital and the movement from physical and digital, but also acknowledging that members might not want to travel long distances anymore, might not feel comfortable on public transport, might not want to engage with services in physical environments, and might want to be accessible at home to their practitioners and have that healthcare at home setting. So how do we figure out what the right place is for healthcare? And finally, it's about the right price. Now more than ever in the economic climate, price is a key driver of health insurance and healthcare purchases. I've really enjoyed sharing this session with you today. Thank you for listening.
Hi there. We are joined now by Dr. Ali Hassan, the Chief Medical Officer at Vitality, who's on the back of his colleague Anushka's presentation is going to take some audience questions for the next 5 minutes or so. So I've already seen that we've got a few come through in the chat, so we'll try and get through as many of these as we can in the time we have. So Ali, we'll go straight into it. So first question we've got for you from the audience is about hard KPIs and how these can measure the acceleration of health digitization and the impact of the pandemic in terms of, I guess this question is asking about quantification, essentially. So what's your thought on how this can be put into numbers?
Thank you, and delighted to be here. That's a great question. I think one of the reasons for our success at Vitality is our kind of strong focus in embedding data and insights into every aspect of our activity too. We're quite lucky to have a very rich data set of claims, and we can draw a lot of inferences about how digitization is progressing as we continue. We also tend to think about this from a pathway perspective. So ultimately, we can look at how many people are using our digital systems and how they're accessing them, and how many people are undertaking care digitally and how we access them, because of how we code our interactions with members, how we code our bills, and how we bring all of this together. We've invested in a really leading set of analytics teams across our organization to make sure we can bring those insights. And I personally know on a regular basis, every week or every month, how many people are having virtual GP consultations, the proportion of people who contacted us via phone versus engaging digitally, and really anything else that we look at too. There's no single KPI that gives the right answer, but we tend to use the balanced scorecard to understand that we are making continued progress to allow our members to access care digitally whilst maintaining an omni-channel experience for people who might prefer to have phone calls or be serviced in a slightly different way.
Okay, our next question looks at claims. So the question is, what percentage of claims do you envisage will be able to achieve instant digital authorization?
Our expectation is that the majority of claims should be able to process digitally instantly. This is a new rollout for us, but it's one that we've certainly had as a twinkle in our eye for many, many years now. And we've been building up towards a solution that can really roll out claims for the majority of our members to have a good potential outcome, because it's so important that they have a great experience with us.
And Ali, I think we've got a time for one more question from the audience. And this is around technology again. So it's asking whether Vitality has any plans to introduce listener technology, such as the microphones in your smartphone or smartwatch that can be used to measure things like well-being or mental health that will inform health plans or health cover going forward.
We are now living in an era where there's a tremendous amount of access to information through all types of sensors. We know that people can tell a tremendous amount through their microphones in terms of speech, intonation, volume, and the words that they're saying. We've also heard about people using light sensors to understand how much people are spending time indoors versus outdoors. Your accelerometers can tell us a tremendous amount of activity too. When we think about how we potentially use this information, we need to understand the potential benefits it could provide to customers, but also the data governance around this and how likely customers are going to be to want to share this information too. It is an area that we continue to monitor in terms of advanced sensors. We don't have any immediate plans to start using that type of information in our more broad activities, but certainly we do follow these technological areas closely. And as and when they become more mainstream, when our customers demand it, or where we feel there's a real opportunity to innovate for our customers, they are things that we would bring on board.
Ali, we're afraid we've run out of time for this Q&A session. So thank you very much for joining us this morning. Really appreciate you taking our audience questions. And again, thanks for sharing your insights.
Thank you for having me.
Thank you. Our next session is a live Q&A with Peter Grinbergs, Chief Medical Officer at EQL, otherwise known as Equal, and Andy Roberts, Finance and IT Director at Medicash. We're going to be talking about Theo Engage, a new service from Equal that has gone live today, this very morning. So it's something of an exclusive for our audience. You can find a news write-up of the launch live on the Cover website this morning.